Do you have low libido? My name is Dr. Megan Brining, and I'm going to be talking about libido tonight on tonight's live because, especially for us women, libido is a very complicated topic. And when you have low libido, the biggest thing that you need to do is figure out the root cause behind why you have the low libido so that you can actually treat it effectively. So, what I want to talk about tonight is a couple of different things that I see in my practice and the conversations that I tend to have with women that are struggling with low libido. And usually I start off the conversation by asking women what their libido scale is like. So where are they on the scale of how high or low their libido is? So when I start the conversation, I always ask women 10 out of 10. If 10 out of 10 is I'm a complete horn dog, give it to me all the time, and 1 out of 10 is ew, don't touch me, where are you on that libido scale? And that is really important to start us off because we all have the spot that we are naturally inclined to with our libido. So some women tend to have higher libidos at baseline and some women tend to have lower libidos at baseline. And for some women, you know, your relationship with yourself sexually and different experiences that you've had, you might not really even know how to grade that because there's some disconnection there. So this conversation really helps get us at least the start of figuring out why you have low libido. If we can't answer this question, then it makes all the rest of it hard because first we have to figure out where are you before we try to actually figure out what's wrong with you. So 10 out of 10, I'm a complete horn dog. 1 out of 10, you don't touch me. So, you know, say you are feeling like you are a 3 out of 10, but you're normally a 6 or a 7 out of 10, you know, that's a significant change. Say you're normally an 8 or 9 out of 10 and you're a 1, you know, that is a huge degree of dysfunction that we need to uncover. So for those of you that just popped on, ask yourself that question and tell me where you guys are. I would love to know because we can help troubleshoot some of this tonight. So ask that question to yourself. And let's see, let's get into it. I want to talk about some of the main reasons why women's libido is low, because we are not as linear as men are when it comes to our sex drives. There's lots of different things that contribute to how we feel as a woman, how we feel desired, if we're comfortable or not, if we're in the mood or not. It all kind of adds into our sexual experience, and it changes every day as well. I don't know if you gals have noticed that. I definitely have with myself. You know, some days things are, you know, there's a lot more cha-cha, and some days there's a lot less cha-cha, and that's totally normal. I'm going to talk about that in a little bit. But there are essentially 5 different things that you have to think about for finding the cause of your low libido. So the first thing is disconnection. I'm going to talk about all these a little bit more. Number 2 would be hormone imbalance. Number 3 would be drugs and medications. And number 4, everybody's favorite, is stress. And then number 5, physical. So out of all of the women that I work with, generally their low libido falls into one of those categories. 1 to 5, sometimes they overlap. And when we start the conversation of low libido, we try to figure out what is the biggest factor in all of these categories that's affecting you. So the first one that I see to be probably the biggest, well, I actually can't say that because there's 3 that tend to be the biggest, which is stress and hormone imbalance and disconnection. But I want to start with disconnection first because, for women, and for men, the sexual experience is experiencing your partner. And so there needs to be a certain amount of connection with that person. And so I like to talk to women about how do they feel about their partner and how do they feel connected to their partner, because if that is changed or that is shifted, that's drastically going to affect their libido. And I also, it's really important to examine the relationship that you have with yourself. You know, do you feel sexy? Do you feel beautiful? Do you feel desired by your partner? Because you can have two types of disconnection. You can have disconnection from yourself, as in you're unsure how to meet your own needs, or you feel disconnected from yourself because you have all these responsibilities and you have work and you have all these things to do. And then there's the whole layer of feeling disconnected from your partner. And depending on what the source of the disconnection is, that will determine what we do. So I'm hoping you guys can kind of see the themes is, we really have to figure out what's going on before we figure out what to do. Towards the end, I will talk a little bit about herbs that can help, because herbs help. I think herbs are great, and there's lots of different herbs that help boost libido, but it's for women, I find that it's not always just an herbal issue. It's not just lack of herbs or the fact that you need herbs to balance something out. It's everything all together. Because I don't know if you guys have ever seen the photo. Dr. Carrie Jones posted this photo once, how the male sex drive is more like a switch. It goes on and off. And the female sex drive is more like all these knobs and dials and clicks on and clicks off. And, we have 20 of those, and men just have an on off. And I always think about that when I'm talking about libido with people, because we're all women here. We've all experienced this, how there's just so many factors that play into this. So disconnection to self and disconnection to partner, or both. That's a very real thing too. So we have to figure out which one is the most problematic. So I'll often ask women, and I'm looking at my notes over here to keep us on track. But one thing that I commonly will ask people is, what ways do you connect to yourself every single day? And what are some ways that you connect with your partner every single day? And the ways that you connect with yourself is probably different than the ways that you connect with your partner. But when you're in a relationship, everybody has a certain way that they communicate love and a certain way that they feel love. And so if you guys have ever heard of the 5 love languages, this plays a big role in, sexual experience and sexual fulfillment. Is how are you talking to your partner, and how are they showing you love? How are you receiving love? Is there a mismatch? So I will often have couples read the 5 love languages book and talk about it. And sometimes I will have them do some personality tests like the Enneagram. Sometimes I will loop in like a Myers-Briggs. Sometimes I will loop in, what was that other one? The Enneagram, the love languages, and attachment styles. So that can sometimes help, especially if you are married to your partner, or you've been with them for a long time and there's just a mismatch for whatever reason that's coming up. Sometimes I like to go back to basics and think about, okay, how are you both uniquely wired, and then how can we build that connection again? So how do you connect with yourself, and how do you connect with your partner every single day? What are some of the ways that you show love to your partner? What are the ways that the partner shows love to you? Because we also need to recognize that people are going to show us love in different ways, and we might not recognize it. And it's important to know how your partner tends to show love to you, because you might need to learn how to speak their language, their love language. You might need to learn how to receive a different kind, and you might need to learn each other's languages to, be really fluent in each other. A big one that is sometimes overlooked is, are you attracted to your partner? And are you still attracted to your partner? Or are there certain behaviors that your partner is recently engaging in, or has been engaging in for a long time, that makes them less attractive to you, and why? And this can be a really uncomfortable question, especially if you guys have felt distance for a while, or there's things that you haven't talked about that's going on in the household. It really can be anything. But sometimes people get on our nerves and people do stuff that annoy us. And that can decrease a feeling of connection because you don't feel heard when someone is doing something that's annoying. And that can translate into lack of attraction sometimes. So I have women critically look at, is their partner doing anything actively that is really not floating their boat? And then we troubleshoot some ways to talk about it, because you can't just approach your partner and be like, you're doing all these things. There's always room to improve on both sides of the spectrum. One thing that has really helped me in my journey with libido and sexuality is this question: do you have any moral factors that you believe influence your libido? And this kind of goes into talking about your upbringing, how you were raised, what you were told about sex growing up, what you were told about pleasure. But this can play a huge role, you guys. Like, if your partner has a different set of morals than you, or you guys are on a different page, or this can factor into anything. But I always have women kind of tease that out, because that can sometimes disrupt libido on a very deep level, especially if it's a childhood thing. Another one of my favorites: have you talked to your partner about your low libido? So this seems really basic, ladies, but I can't tell you how many people that I've asked, how many women I've asked this question, and they haven't had a really open and in-depth and vulnerable discussion with their partner. And that's a problem, because if you're finally sitting in my office talking to me about the libido issues that you're experiencing, then generally it's at a certain point where it's disruptive. And so I can only imagine how your partner would feel if they knew that you were, going through this without having told them. So I always try to get partners to be talking again, because you can't fix something if you don't talk about it. So really basic, but talk to your partner about your libido, and maybe give yourself about 5 minutes to lay all your cards on the table and give them a chance to respond. What tends to happen with relationships over time is that we make assumptions about how people are going to respond or act. And so I often like to enact the 5-minute rule so that couples can actually get out what they need to say and then have some time to respond. So there's not a lot of interrupting or getting into your story and things like that. How do they respond? Also, what is the bedroom environment like? So, is your bed comfortable? Is it smelly in the bedroom? Is the bedroom clean? Do you have animals in the bedroom? Is it a relaxing space? Is it noisy? For women, we take in the world, especially the feminine side of us as women. We have so many senses by which we interact with the world. And some of us are more in tune with our environment, and that can affect us more, and some women are not. But you definitely have to think about, is this a comfortable space? And, do you like your bedspread? Does the bed squeak? All of these things that could possibly play a role into you not being able to be relaxed and have a good time. So I have a bunch of questions here. I don't want to necessarily go into all of them because I don't want to be here all night, but I think you guys kind of know what I mean in terms of really examining the whole experience. The last thing that I would say is, in this disconnect category, this 1 out of 5 is, if you have had any sort of sexual experiences that did not go well, or sexual trauma, or any sort of issue with sexual boundaries, I would definitely recommend you sitting down and talking to somebody about that, because women that have had that type of trauma in their past, they tend to, depending on the woman, go to a different place and view their sexuality in a very different way than women that haven't had those experiences. So, if you've had any histories of different vaginal infections or traumas, abortions, any sexual trauma of any kind, we got to work that out and dig deep into that and heal that, because that can really lead into libido issues for women. So, disconnection, really important. But that's a big one. And it's especially a big one for women as they age, or women that are postpartum and that have had children, because as our bodies change and our priority changes, so does our relationship with ourselves. And so we're always needing to, as women, I believe, reconnect with ourselves so that we can experience the, have the sexual experience that we want to have. So, reconnect with yourself if you guys haven't yet, or if it's been a really long time. The next category, which you guys know, hormones are my jam. Excuse me. The next category is hormone imbalance. So, hormone imbalance is typically at the top of my list because your hormones need to, number one, be there, and number two, be balanced for your libido to be supported and for you to have a good libido. So, imbalance or lack of almost any hormone can affect our sexual experience. One hormone that really we need to talk about here is estrogen. So estrogen is like a Goldilocks hormone. Estrogen is awesome, but estrogen, if too high, can cause problems, and estrogen, if too low, can cause problems. So estrogen, when too low, can cause low libido, and estrogen, when too high, can cause low libido. So this is where testing comes in. So you can get testing, serum testing, you can get Dutch testing to actually see if that's a problem. But I do see that fairly frequently in the women that I work with. But cortisol is another hormone, just like estrogen, that if it's too low or too high can cause libido problems. And cortisol is our stress hormone. So we know that if we are more stressed, then usually we tend to make more cortisol. And so if we have too much cortisol, then we're not going to be feeling the cha-cha like we normally do. So estrogen and cortisol are definitely two that, we want to be right in the middle. Other hormones like DHEA, progesterone, and testosterone, those, if they're too low, they tend to cause low libido as well. And because as women, we have a whole variety of hormonal experiences in our life, like puberty, like, having a regular menstrual cycle, like pregnancy, postpartum, perimenopause, menopause, as these hormones are fluctuating in these times and they're changing, then we know that the hormones can affect how you actually feel. So it's important to think about what exactly is going on with your hormones, no matter what state you're in, whether you are having a regular period, whether you're not, whether you are postpartum or not, whether you're in perimenopause or not. And really the key to figuring out whether it's your hormones that are affecting your libido is to test. And testing is the best. If you guys haven't been watching my videos before, you know that I am, please know that I'm super into testing, and testing tells us a bunch of information. So if you are thinking that your libido is caused by hormones going all up and down and topsy-turvy, then I would get a test. I would do a serum blood test, and I'd also do a Dutch test, which is a urine hormone test, which tells us a lot of info. So when hormones are off, the idea is to balance hormones, and balancing hormones looks different depending on what stage of life you're in as a woman. I got some questions early on about postpartum and what we do for postpartum hormone imbalance, because any type of hormone imbalance can cause lack of cha-cha. any type. Postpartum is a unique period of time in life because you're in a new body that you've never had. You just had a baby. You're caring for that child. You might be caring for other children in the home, other partners. You might have work or other responsibilities. Breastfeeding in and of itself is a full-time job. So when you have a baby, your priorities totally change. And I see a lot of women postpartum have just naturally lower libido because their focus is on something else. So there's a fine line between when is my libido issue a problem postpartum and when is it not. And the way that I figure that out is, how much of this lack of libido postpartum is actually distressing to you. So is it really distressing to you that you don't have a libido, or is it distressing to you because your partner really wants to have sex and you're not as into it because your priorities have changed and you have a lot of responsibilities, and their want for that and their want for you to want it is stressing you out. So I always have that conversation with women because postpartum is very unique. You're adjusting to all those responsibilities, but also generally, especially if a woman is breastfeeding, she has high prolactin levels, which actually suppress the return of her menses. So women typically don't get periods until a certain period of time postpartum, and that's different for every woman, so we can't ever know. But when a woman gets her first menstrual period back after baby, this is called return of fertility. And return of fertility happens when you have ovulated and then you've had a period. And we figure that out by the fact that you had your first period after you had a baby. But we never know when that return of fertility is going to happen. And generally, once the return of fertility happens, women tend to feel better because their body will often get into a normal rhythm of ovulation. But for some women, that doesn't happen. So I know I'm kind of talking about all this stuff about postpartum, and it's like, okay, well, if return of fertility is variable for women, and so is ovulation with the return of fertility postpartum for women, then how the heck do we figure out, what is actually happening? And what I recommend for this period of time for women, and pretty much almost any time for women, is basal body temperature tracking, because that actually will show you what is going on with your hormones. Because what happens with ovulation is that we make progesterone when we ovulate. And progesterone is a hormone that naturally increases your body's basal body temperature. So women are warmer in the second half of their cycles after they've ovulated, which is great because if we're taking our basal body temperature each morning, then we can see the shift up in our temperatures, which is generally sustained until we have our menstrual cycle again and the temperature comes down when there's no more progesterone around. So if you're trying to figure out what's going on with your hormones postpartum, one really, really easy way to do that is to chart your basal body temperatures and see what's actually happening. What's cool that way is that you'll be able to see your ovulation happen before you actually get your first period. So that's one way to think about hormone imbalance postpartum. But the way that we treat somebody postpartum is going to be very different depending on what their goals are. So some women, just want to be able to have sex again. Some women have, goals for future babies. Some women, it's their stress or their mood. It all kind of depends what your goals are. And especially if you're breastfeeding or not. Because if you're breastfeeding, there's always a chance that whatever we give you can transfer to baby. So we don't necessarily want to start a lot of different treatments postpartum. So when I'm talking to women about their libido postpartum, I'm always asking, what's distressing to you? What are your goals? How have you healed? How are you feeling? Because sometimes what will happen is that if we support a woman with her stress levels and her mood, and maybe we're doing some adrenal adaptogens, we're working on cortisol, we're working on blood sugar, we're getting nutrition back on track, then often her libido will improve. Or sometimes what happens is a woman doesn't have a lot of support at home, whether it's because their partner is traveling or has a demanding job, or whether they don't have family in the area or whatever. Sometimes it can be really helpful to get a doula over to the house that can actually help with baby sleeping, mom sleeping, feedings, all of that type of thing. So definitely ask for help in this period of time postpartum if you're feeling all over the place. Another time that hormone imbalance tends to really affect libido is when a woman is taking an oral contraceptive pill. When you're on the birth control pill, your hormones are at a very steady state. They don't fluctuate like normal menstrual period, like the hormones when you have your menstrual period, your whole menstrual cycle. My goodness. But what's interesting for women that take the pill is that not all women will actually report having a low libido. Some women actually report a higher libido, or that their libido doesn't change. So it might not be your oral contraceptive pill that's changing your libido. I would think back to when you got on the pill, because that will tell us, was it actually the pill or was it something else? The other time where hormone imbalance tends to be big for affecting libido is menopause. Because in menopause, what's happening is your estrogen has gone down and your progesterone goes down as well because you're no longer ovulating. And cortisol tends to be a little bit all over the place as your body's adjusting to this new normal. And then testosterone and DHEA might also decline as well. And testosterone and DHEA are two male hormones. And what's cool about testosterone for us women is that it's part of our libido. It's part of our just in general drive and motivation. And so if we don't have a lot of testosterone around, then generally women tend to have lower libidos. But again, the way to figure this out is to test. You absolutely have to test this. And especially in menopause, it's pretty easy because you don't have a menstrual cycle and you can just test it any time. So what I often do for women in menopause when their hormones are all off and that's affecting their libido is we support their stress and their adrenal systems, and we support them possibly, depending on the case, with bioidentical hormone replacement therapy. And both of those can be actually hugely helpful. But herbs for hormone balancing are really, really powerful, and I will often use them for women no matter what stage of life they're in, whether they're menopausal, postpartum, they're on the pill, they're off the pill, and that can be a huge improvement with libido. And I'm going to talk about herbs in a little bit. The third category that you have to think about is drugs and medications. So one drug class that I see be a big issue with causing low libido is SSRIs, which is a type of drug that inhibits serotonin and keeps it in the synapse so it can bind longer. So these are medications that people typically take if they are either depressed or anxious. But really any meds that change serotonin, dopamine, and other catecholamines and other neurotransmitters can cause low libido issues. If you are on medications, I would highly recommend that you, I'd highly recommend that you think back to when you started those medications, what your libido was like then, rate it on the scale, and then see, was my change in libido from initiating this drug, this medication, or was it from something else? So that can help. Take a look there. But sometimes it's just meds, you guys. And I see this sometimes with the oral contraceptive pill. Women are just feeling really flat with their libido. And, when you're taking a drug, if you can get off of it, then I always recommend that people do it if it's safe and if it's okay and if it's within your goals. But that getting off any sort of medication that can be affecting your libido can sometimes just be the thing that helps. So the fourth category is stress. So Stress and libido, this is something that I think most people underestimate, because stress, kind of like what we were talking before in the disconnection, with disconnection, if you have any sort of disconnection or hormonal imbalance or physical problem, or you're taking any sort of medication, that in and of itself is stress, let alone all the other stress that we are experiencing day to day. So stress is probably the biggest one that people underestimate when it comes to low libido. Stress can be physical, mental, emotional, spiritual. It can be all of them. It can be one of them. So really getting a good grasp on your stress levels, because you guys, if you're stressed, it generally means that you have more of an ability, or it's quicker, to get into that fight or flight response mode, that sympathetic overdrive mode, which we are mostly chronically in anyways. So if you're stressed and you're in sympathetic mode, you actually need to get into parasympathetic mode, parasympathetic, not sympathetic, in order to get aroused, have an orgasm, lubricate, and do all of that. So if stress is something that you are dealing with, or you're denying, or that has just been plaguing you for a long time, it can 100% be the thing that's causing your low libido. And so I would definitely take a really good inventory of your life and think, one thing I always ask women is, do you feel more cha-cha? Does your libido improve when you're on vacation? Does it improve when you're on vacation? Because if your libido goes from, a 3 out of 10 on the scale to a 7 or 8 out of 10 on the scale when you're on vacation, it could be the stress, it could be the different foods, it could be the sleep that you're getting on vacation, it could be the outdoors, it could be so many different things. But in general, what I see is that the lack of stress and the lack of the grind of daily responsibilities is what's actually helping women to relax and get into that receptive state and feel more cha-cha. So ask yourself how your sex was like on the last vacation, because that can be very telling. Also, if you have children, when was your last kidless vacation? Because if you're a mom, you know that the kids definitely change vacation. And when you go just with your partner, that it's very different. So take a look at that, and maybe schedule some reconnect time with your partner without any distractions, and see if you guys can get into that rhythm again. See if you can get the cha-cha back. So the last category that I want to talk about is physical. So physical contributors to low libido. This can be so many things. This can be if someone has actually had a physical trauma or an injury to the area that they need healed, whether it's assault or whether it's something like pregnancy. Pregnancy stretches out the whole area, and we have to essentially relearn and rehab the pelvic floor when a woman has had a vaginal birth. So sometimes women are not fully healed from pregnancy. Even years later, they haven't addressed their chronic pelvic floor issues. So that's a big problem. Vaginismus is a problem. Any sort of pain with sex, whether it's, from like lack of lubrication of the tissue because you're in menopause, or whether it's because, when they sewed you up when you had your baby, they put a husband stitch in, so now you're too tight and you have to use dilators. It can be so many different things, because if sex is painful, why are you going to feel cha-cha? Why are you going to want to do it? And that pain is a very strong signal in the body, and pain, it very much informs how your brain interacts with all of the other systems. So if there's any sort of pain with sex, your body's going to want to naturally dial down that drive for it. So one of the biggest things that you can do is work with a provider to help figure out, why do you have pain with sex? Is it pain when he enters you, or is it pain when he's inside of you? Is it pain with friction? Is it pain when you actually orgasm? Do you get headaches after sex? Do you, any sort of different way that it could be painful definitely needs to be looked at, because that's going to start like a negative feedback loop of telling your body, oh my gosh, this is not a good thing, where it is actually a good thing and we all like sex. So definitely talk to a provider about that. I always ask women, basics like, are you able to self-lubricate? If you're not able to self-lubricate, then why? And do you guys have a good lube that you like? Are you even actually able to have an orgasm, whether it's solo or with your partner? But one thing that I feel like nobody talks about is there any mismatch in size? Us women, our vaginas are awesome because they do stretch to accommodate any sort of sized man. But there are some big boys out there and there are some smaller women out there. And so if there's any sort of mismatch between you and your partner, you need to figure out how to make that work for you guys, and have it, not be painful for the woman, but also have it be, good for the man. So is there any sort of mismatch? Because there's lots of different sexual positions that tend to help, whether he's big or small or you're small or whatever. So there are definitely real physical things that can contribute to why a woman will have low libido. But as I've been saying this whole time, the key is figuring out what the root issue is. So for those of you that just popped on, I was talking about the 5 main reasons why a woman has low libido. So number 1 is connection. Number 2, disconnection. Disconnection, we want the connection. That's what we want. Disconnection, hormone imbalance, physical problems, medication and drug use, and stress. So if you missed those, go back and give it a listen. I am going to post up on my Instagram a couple of the questions that we went through tonight that can really help you start to reconnect with yourself and help you examine what are some of the possible reasons that you could have low libido. Because if you can do part of the work and help yourself determine what it could be, it will save you some time with a provider, because the treatments that we use are very different depending on what the actual problem is. So, like if, for instance, you have pain with sex and you're in menopause, then, we could give you some vaginal estriol cream, bring some life back to the tissue, and sex is not painful, and now you can have sex freely. If stress is a big problem, then think about ways that you could take some things off your plate or delegate or have your partner help you with different things. If you are, if you're feeling disconnected from your partner, then there are multiple different ways that you can reconnect with them and reestablish that connection and get that cha-cha back. But I promised you guys I would talk about herbs for libido, because they will help most people, especially if there's stress involved, or especially if there's hormonal imbalance. But if stress or hormonal imbalance is not the root cause of your libido problem, your low libido, then you're mostly, really not going to be doing too much. That's why I'm harping on the root cause. You got to look at those 5 categories and figure out where you fall, and then work with a provider to figure out what to do. But my favorite herbs, I've got 6 of them, that tend to do really well for libido are maca, tribulus, damiana, horny goat weed, isn't that fun? Avena sativa, and yohimbe. So those are my top 6 for supporting libido. And you can get all of these in different supplements and capsules. You can take them singly. There are differences in quality and testing and that type of thing. I use Full Script, and you can order through me if you'd like. And then you know that you're getting supplements that actually work, which is awesome. I've actually had a lot of success with the Gaia brand, their libido, I don't know what they call it. What do they call it? Their libido formula, women's libido. I've had some pretty good results with that. But I don't always turn to herbs because unless your issue is hormonal imbalance or stress, then the herbs aren't going to do squat for you. So it's really important to figure this out. But, if you have some sort of hormonal imbalance or you want a little kick in the pants physiologically to help you with this, then doing a trial of herbs, especially with these herbs that are pretty safe, is, there's nothing wrong with that. You can always try things. I know for some women, they've been low libido for some time and they're just really wanting to switch that narrative, and so there's nothing wrong with trying that, even if it doesn't meet the criteria that I was talking about. But again, the root cause will really get you somewhere. So those 6 herbs are maca, tribulus, damiana, horny goat weed, avena sativa, and yohimbe. So and for those of you that just popped on, if you have any questions, I will answer them. But I also want to talk about a couple of things that you might not know about women's libido. One thing that people commonly don't know is that for menstruating women that have their menstrual cycles, because your hormones change over the month, there is a natural ebb and flow of libido. So I think there's this idea that women have a very similar libido to men, in the sense that women are always drawn to it and they always will want it. I would say that's true of most of the men that I work with, but women aren't necessarily like that. There are some women, like I was talking about before, that have much higher sex drives at baseline than other people. But for a lot of women, their hormones and their actual libido and drive to have sex, that drastically changes depending on where they are in the menstrual cycle. So what does this look like? This looks like it has to do with how your hormones fluctuate. So for instance, testosterone is a hormone that we were talking about that really supports and gives women drive, gives them cha-cha, gives them libido. And your testosterone will shift a little bit over the month. It commonly peaks right before ovulation, which, surprise, surprise, if it goes up a little bit before ovulation and you're more likely to have sex, you're also more likely to have a baby and therefore populate the earth and do what your body was biologically designed to do. So that is built in to our wiring. So a lot of women will tell me that they feel just way more horny in, the whole week leading up to ovulation. And ovulation is typically in the middle part of women's cycles. And so usually women finish their period and then they notice, a marked increase in, I want to have sex with my partner. It sounds good. I feel really sexy and grounded right now. But what can happen after ovulation is that feeling isn't as strong anymore. And so a lot of women say that in their luteal phase, or that second half of their cycle, that they don't feel as inclined to have sex, and their drive is different than that first half of their cycle. So I would definitely like to bring some awareness to this, because I often have women tell me, like, sometimes I really want it and sometimes I don't. And that can be totally normal. Like, hear this, that can be totally normal. And what is helpful is if you track that, because your natural drive might correspond with how your hormones are fluctuating in your menstrual cycle. So by menstrual cycle, I mean the whole cycle of your hormones from period to period. And there are normal variations of this, but if something is really, really low, or there's a big change, or somebody just doesn't feel anything, throughout the whole cycle, then that's a clue that we need to look into something. But you can have totally normal ups and downs of libido in your menstrual cycle because of the effect of how your hormones fluctuate in the menstrual cycle. And I feel like not a lot of women know that, so they get really concerned, especially in their luteal phase. They're like, oh, sex doesn't sound as good, or I don't want it as much. And it's like, girl, you're just at a different hormone time in the cycle. So know that. I would say the most common the most common low libido population that I see is menopausal women, because your hormones have just shifted to, what they were when you started puberty. It's kind of like reverse puberty is what menopause is. So for women that have low libido in menopause, that's due to hormone imbalance, then hormone therapy can help. So if you haven't looked into that, definitely look into bioidentical hormone replacement therapy, because it can be very great for that population. One thing else that you might not know is that a lack of connection to your feminine as a woman can lead to a huge effect on your libido. So the feminine is all about allowing and receiving and enjoying and, experiencing all five senses. The masculine is a lot more about doing and achieving and accomplishing, and the feminine is much more laid back and open and receiving, whereas the masculine is more giving. And that naturally happens with sex because we receive the male. But what's interesting about the polarity between feminine and masculine is that we all have different feminine sides and different masculine sides in us, different wiring. We all have a feminine and masculine side. But as women, generally our feminine is more strong. But because we live in this world that is modernized and so go, 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 what can often happen is women lose total disconnection to their feminine and what it's like for them to relax and be grounded and actually receive love. And if that sounds like you, then definitely look into this type of work a little bit more. This is something that I've looked into in my life, and as a doctor and a female entrepreneur, I'm going all the time. I always have something to do. There's always something on my mind. So I have to work really hard at sitting back and relaxing and receiving and, being present with myself, being present with my husband, because my brain can get stuck in that go, go, go masculine mode. And so often I just need to really reconnect to, what makes me feel feminine, what makes me feel beautiful, what makes me feel sexy. And I find that this affects women as well. But it's not often talked about because it's a little taboo. Like, it's a little weird probably to hear me talk about this as a naturopathic doctor. But I believe that for, a really awesome sexual relationship to happen, there needs to be polarity between feminine and masculine for the fireworks to happen. And I'm not talking about same-sex relationships. I'm only talking about heterosexual relationships in this case. Disclaimer. But yeah, lack of connection to your feminine can cause a huge issue with your libido and your ability to connect with yourself and your partner. So if you're listening to this and you're like, what is the feminine? I have no idea what you're talking about, and I haven't felt grounded since who knows when, then look up on Google a little bit more about feminine energy work, because that can be really, really helpful. And then lastly, I think I've talked about this enough, but if we don't know the cause, then the herbs that we often use for libido aren't going to help. So unless you have hormone imbalance or you have stress, then all of the great naturopathic herbs aren't really going to do too much for you. You can give them a try because they're mostly pretty safe. But the key is really figuring out what is the root cause of your problem. So for those of you that are just tuning in, we went through 5 main reasons why women have low libido tonight. We talked about disconnection to self and partner. We talked about hormone imbalance. We talked about medication use. We talked about the effect of stress on libido. And we also talked about physical abnormalities that can affect the ability to have sex and receive sex and feel good when we're having sex. So I hope this was helpful. And if you guys have questions, feel free to ping them in the comments. I will answer them. But if I've learned anything with working with women over the last, several years, going on, where I'm in year 5, you guys, of practice, is that there's just so many different reasons why we might have lost our libido and lost our connection. And sometimes it's hormonal and it's a physiological problem. And sometimes it's just a complete disconnection from our partner, from ourselves, what we like, what we know, what our bodies feel like, what we think about our bodies. So I would encourage you to really dig deep and think about these for yourself. It can save you a lot of money before you go to a provider. But if you think you have a hormonal issue, get it tested. Because what are you waiting for? Let's bring the sex back. Let's let you have some cha-cha again. And thanks everybody for coming. My name is Dr. Megan Brining, and please send me a comment. Share this with anybody that you think it would help. And I do these Instagram lives every Monday night at 5 p.m. Pacific. So you'll always find me here. And next week, let's see, what's next week? Next week is on my Instagram. But I can tell you what next week is. Next week is how to figure out your hormones postpartum. So I talked a little bit about that tonight. Tonight was all about how to improve your libido, but next week is going to be how to figure out your hormones postpartum. I know I get a bunch of questions on this, and we will talk about what exactly to do to really know what is happening postpartum. But yeah, and then we're going to talk about perimenopause in a couple weeks, and then we're going to talk about pregnancy prep. So if you guys don't know me, I talk hormones. I live and breathe hormones. Hormones are my jam. They make me super excited, and I'm always excited to bring this information to you. So feel free to tune in next week, and thanks everybody for coming, and have a great night.